Facial fillers or lower lid surgery. Hello, I'm 28 years old and unsure of which route to go.
Thank you for your question. You're 28 years old, you've submitted a single photo, and you're asking whether to have fillers done to improve the under eye area or to have surgery. Well, looking at your photo, and although we don't see a side view, I think it's reasonable to conclude that you have a significant amount of puffiness under your eyes. And I understand why you're confused, because when you do research on how to treat puffy under eye bags, you're seeing these conflicting options, and naturally it's confusing. Well, I'm a cosmetic oculofacial plastic surgeon. I specialize in eyelid surgery, and I do a lot of under eye bag treatment. So I can share with you my experience being able to do both the surgery and the injection on what my threshold is as to how I make the decision between filler versus surgery. Let's start first by learning what is the underlying issue. The underlying issue is an anatomic change. That anatomic change is called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the puffy bags that represent fat, and this fat was normally behind a structure called the septum. It shifted forward and creates these permanent bags, this appearance that you always look tired, always look sleepy. Now, that means that there are different degrees in which the puffy bags prolapse forward. We refer to it as lower eyelid fat prolapse. When it's very, very slight, and a typical history will be when a patient says that they have a lot of good days, but occasionally some bad days. That typically means there's just a little bit of puffiness, and there are times where they see it more than others, but it's very slight. Those patients tend to benefit with filler because there's not a lot to camouflage. The point of a filler is to soften the contrast between the puffy bag and the adjacent tissue. And that area we refer to as the tear trough or the eyelid-cheek junction. And that continuous area we can strategically and artistically soften with the use of a filler such as hyaluronic acid. Now, as a specialist, I get to see lots of people who have puffy under eye bags who had way too much filler placed under their eyes because a well-meaning doctor wanted to try to help them avoid surgery, and they ended up with so much volume of hyaluronic acid under their eyes that they actually looked even puffier and they look weird. And so we end up using a chemical called hyaluronidase, which is an enzyme, to break it down and make the stuff disappear. So I think from the photo that you submitted, you're probably a better candidate for surgery. Now, naturally, when you're 28, you wonder why at this age are you having cosmetic surgery. But I could tell you that the puffy under eye bags is not in the same category as, let's say, a surgery related to facial aging, such as facelifting, which is really much more consistent with the middle to later decades of life. We've operated on people as young as 14 for under eye bags, and this is because this is a genetic issue, and so you can be very young and still have under eye bags. The point is when you think about surgery, there are natural hesitations. So I'll let you know what we did in our practice to help our patients overcome that. First of all, we do our procedures in our own Joint Commission approved operating facilities. This is the same certifying body that approves hospital facilities. So we're committed to safety and ensuring that our patients have no less quality of care and really have optimal care in terms of safety. The other aspect of this is doing the procedure in our facility within our office. This is a much more friendly and less threatening atmosphere than someone going into a hospital and then going through multiple departments and kind of the dehumanizing aspects of institutional care. And On top of that, we do the procedure under local anesthesia with light intravenous sedation. This means we don't do general anesthesia, and our patients are able to feel comfortable that they're not going to be out and on a respirator like you would be on general anesthesia. We can also do these procedures under straight local anesthesia with patients wide awake, and we've proven that for years, and the safety record has been great and there's never been an issue. So, putting all those things together, it's almost like the surgery is not that different from having the injectable. In addition to that, people are also afraid of bruising and swelling after surgery. Well, with this process that we have in our practice and with the experience that I've gained over 20 years, we're able to really effectively minimize bruising after surgery. And there are many times people have come and seen us 1 week after surgery and they have virtually no bruise at all, and I would argue that you can get more bruising with getting injectables oftentimes than surgery. Of course, it's always a case-by-case basis. But that being said, I think that based on your photo, you're probably a better candidate for surgery. Now, what type of surgery? The procedure that I typically do for under-eye bags is something called transconjunctival blepharoplasty. One of the other objections people have is a fear of scars, and they desire to avoid some kind of external scar that shows that they had surgery. So what we do is we do a procedure where we work from the inside of the eyelid. And by working from the inside of the eyelid, we're able to reduce and reposition the fat as is appropriate to get a very nice natural appearance, and there's no external incision. So people feel very comfortable and confident that no one would ever know that they had surgery. I think that under-eye bags make such a tremendous impact on a person's facial appearance. It's no secret that it's one of the most popular things we do in our practice, and it's literally is like doing a facelift where the eyes being brighter and more open and not looking tired really brightens up the whole face. So I think that at this point you should meet with qualified, experienced cosmetic surgeons and learn about your options. Make sure you go see somebody who is a real expert in eyelid surgery. I've always been a firm believer in specialization and making this, helping the patients get the best results by seeing people who are really experienced in any particular surgery. It's no secret that surgeons who do a particular thing a lot tend to do them very well. Of course, you also have to look at the artistic style and whether or not this is something you're comfortable with the doctor, and that's more of a intangible. So I hope that was helpful. I wish you the best of luck, and thank you for your question.